Is this thing on? It is not. Is it?
They are not.
There we go. All right. So I'm Langston Verdin. I am the co-executive director of MKE FreshAir Collective. We are a environmental health, air quality organization here in Milwaukee. So we focus on air quality issues, primarily outdoor air quality right now in Milwaukee. We have deployed about 20 air quality sensors, predominantly in Black and brown communities across the city of Milwaukee. I started this organization in 2019, really because at the time I was working in Children's, Wisconsin, and noticed some disturbing patterns related to asthma utilization. And I was born in a household that when you see things that are wrong, you do something about it. And you know, we are in a health institution, and we all know that healthcare is slow. And I was not okay with the pace of change that was happening around me. And so I started to work to do something about it. So I partnered with an organization called IQ Air, who we still partner with to this day. They sent us two air sensors for free to test out, and we deployed them immediately. They've been a fantastic partner of ours to this day, and like I said, we've got a ton of sensors deployed now, and now we've expanded the work to be more than just about deploying sensors, but really about educating the community, about working on policy, and making it so that community members don't have to do all the work. You know, air quality is one of those things that it's kind of like the saying, where you should be able to drink that cup of water and not have to worry about it, right? It's the same thing with air. You should be able to go outside and breathe and not have to worry about it. Really, that's what our aim is with MKE FreshAir Collective. We wanted to make sure that our community should be able to go outside, breathe fresh air, not have to worry about it. So that's our aim. That's what we aim to do as an organization.
Okay, can you guys hear me? Is this on? Yes, okay. So thanks for the introductions, Mark. My name is Kayla Rinderknecht, and I am the Population Health Fellow with Clean Wisconsin. And I first became interested in public health as, I wanted to know the answer to the question, why do people experience differences in health? Why do people experience differences in health outcomes? And this, I wanted to try to answer this in a systemic way and through policy. And I wanted to try to, help improve the well-being of my community. And this sort of led me down the path of wanting to look at, access to healthcare disparities and policies like the Affordable Care Act. And throughout that, I realized that there are other determinants that influence a person's health. And with that, it kind of led me to a more focus on health equity in general. And this fellowship that Raphie and I are a part of, it is through UW-Madison, and it places a recent public health graduate with a public health organization who's aiming to improve health equity in the state of Wisconsin. And this being said, Clean Wisconsin brought me on to help launch their new environmental health initiative. And I'm going to dive deeper into that initiative throughout the panel, but basically this initiative encompasses Clean Wisconsin's updated strategic plan, where we identified health and environmental, or human health and environmental health as an organizational focus. And additionally, I think that this initiative reflects the updated mission statement that Mark mentioned at the beginning. And the health consequences of environmental pollution and climate change have always been a part of Clean Wisconsin's work, but we really wanted to focus in on this and make sure to center public health in our advocacy. And I think that this intersection between the environment and public health, it's everything. It's the environment that we reside in, it's the air that we breathe, it's the water that we drink, and I think the fact that we're here today having this conversation is a great step in the right direction.
Thank you, Kayla, for giving the rundown on the fellowship, so I don't have to do that. Good evening, everyone. I'm Raphie Torralba. I'm a second-year fellow with the fellowship, and I'm placed at 16th Street Community Health Centers in the Department of Environmental Health and Community Wellness. So some of the work that I do there at 16th Street revolves around writing and implementing curriculum for our nature or our outdoor and environmental health education, as well as a family nutrition education program. I've also done a little bit of community needs assessment work with our community health department. So I kind of came into environmental health on accident. Well, through this placement, my interests really revolved around community health and particularly immigrant health. And being placed at 16th Street, I've really learned how those are severely intertwined with each other. So I'd say that I'm willing to explore more environmental health work because I witnessed the work that's being done at 16th Street, and we'll talk about a little bit of that later, but it's numerous, it's innovative, and they really prioritize and strive for those important community engagement and community collaboration to make sure that communities are experiencing the safest, healthiest, cleanest Wisconsin that they can.
Good evening, everybody. I'm Christa Wagner, Director of MCW's Center for Sustainability, Health, and the Environment, or the SHE Center. The center has been in existence for about a year, the amount of time that I've been here on campus. I have a bit of a convoluted path to this space. I was a biochemist by training and then went into human genetics and immunology. And worked with a rare disease population. I've always been interested in improving human health, not as a clinician, but what can we do from the laboratory? What are the other ways that we can improve health? And working with patients with a rare condition, I got to understand some of the inequities in policies that existed for those patients I was working with to better understand their conditions and how to support their families. And took a fellowship in health policy. So I started working in Washington, D.C. on Capitol Hill for a little while, and most recently with the Association of American Medical Colleges, which is a national organization that represents all medical schools and major teaching hospitals in the United States. And my role was to advocate and produce policy to support academic medical centers in improving the health of their communities through 4 mission areas: education of our learners, research, patient care, and community engagement. And one thing we were really starting to work on was how are academic medical centers supporting how their students understand climate change and its impact on the patients they serve, and how are those institutions doing better to be good stewards of the environment, considering the vast amount of waste that we have in operating rooms and in the care of our patients, and the carbon dioxide that is produced in the care of patients. So meeting peers across the country, I was really excited to come to MCW to be the leader of this new center and really utilize those 4 mission areas and the enthusiasm on this campus, and then build relationships with the community. So meeting Clean Wisconsin in the last several months has been a fabulous way to think about how to grow how we support the health of our patients through educating our new medical doctors, our new researchers, our new public health professionals, engaging them in the community, and building some policy and advocacy work to make the state a better, healthier place for all of us.
Thank you. So environmental determinants of health, those are some big kind of fancy words. Maybe Christa, you just sort of explain what that means, and then each of you maybe could tell us a little bit of, there's many of those environmental determinants of health as we know, so maybe tell us a little bit, each of you, what you're working on specifically related to that.
Sure. So I'm not the public health professional at the table, so the folks here can add more to this flavor, but we talked a little bit about social determinants of health. So what beyond your genetic code is impacting your health outcomes? And when we talk about environmental determinants of health, it's things like air pollution, water quality, indoor air quality. What are the things surrounding you and the environment that are impacting your health? So something I've learned a lot about here in Milwaukee is heat islands. in the city. There are areas of the city where the tree canopy cover is not as great, and so those regions of the city get hotter on really hot days. It can be up to 20 degrees warmer in those neighborhoods. So a project that I partnered with a UWM MPH student this summer and a pediatrician here at Children's Wisconsin and an epidemiologist was to better understand where do patients with sickle cell disease live in Milwaukee, and is that in an area where there's a higher rate of heat islands, and could that be exacerbating pain crises in sickle cell disease patients? And can we educate our providers so that they are better informed about where their patients live, about those environmental determinants of health, so they can better take care of their patients in those clinic visits, advise them to go see a physician when a hot day is coming, advise them to stay inside if possible. So those are some of the things we're working on here, is what are some of the diseases we see in higher prevalence in the city? What are the environmental impacts on them? How can we educate our learners and physicians to better take care of their patients with that frame of reference?
Thank you. So at 16th Street, I mentioned that I worked on a curriculum for an outdoor education program. So that program is for elementary students on the south side of Milwaukee. It's not limited to south side students, but that's typically where a lot of the participants come from. And I think through that program, I like to think that we are addressing a lot of determinants, environmental determinants, and I'll include sustainable communities as part of an environmental determinant of health. It's really a big opportunity for kids who are impacted the most by these environmental issues to gain experiences and feel connected to nature, to their communities, develop their understanding and of that relationship between their health, their communities, and themselves. Because many people, a lot of the kids coming into the program, they know pollution is bad. They know they contribute to it. They know not individuals, not communities, but larger entities may be contributing to it. But they don't feel connected to the consequences of it. And so the goal of that education or outdoor education is to really provide that experience for students. So we do a lot of experiential learning, a lot of field trips. We try to make it very field trip heavy. It's administered as a summer camp over the summer, it just ended a couple weeks ago, and also as an after-school program with 2 partnered elementary schools in the south side as well. And it's just an opportunity for students to realize how much they are connected to everything around them. And I also like to call it systems thinking for kids. Some of the curriculum, it starts from myself as a community to my body, my food, my friends, my family, my city, my world. But we also want to bring in that environmental context, right? That they are connected to the nature around them. And so we have lessons like my rivers as a community, my parks as a community, global citizenship as a community. And these topics are not too large for 7 to 12-year-olds. They really take it all in, and they learn, and they bring it home to their families, and their families want to learn more. And I want to go through some of the questions that we get them thinking about because we have repeat campers. We have a girl who just graduated from the program. She's 12 years old. She started when she was 6, so she was coming back every year. But some of those questions that we kind of embed into the lessons are, who uses green spaces? How are they used? Who's able to use them? What happens when you can't use them? Who makes decisions about those places? Who are the people who came before us and used these places? How did they use that space? And what happens if we aren't protecting them or taking care of them? And I'll add into that they wrote a letter to our local politicians about keeping the domes open because they said, I really like the domes. I don't know if I care if it gets closed, but then other kids like me won't be able to learn about the plants all around our country. And so it's really providing a lot of this education, and maybe that's a step towards addressing the social determinants and environmental determinants of health.
So the short answer is, for Clean Wisconsin, is that we're pretty much looking at all all the determinants right now at a pretty high level. So the basic goal of the first few stages of this new initiative is to develop a comprehensive understanding of how environmental pollution and climate change is impacting public health in Wisconsin specifically. So this starts with an initial screening process, which we're in right now, where we're trying to narrow in on determinants and locations where we're seeing the highest impact. And we're doing this by using existing indices such as the CDC's Environmental Justice Index. So then after initial screening is when we can really focus in on the determinants that are more prominent, and we can try and fill that gap and lack of understanding in Wisconsin on the determinants that are more pressing and are causing the biggest burden for populations throughout the state. So the questions that we're really asking are, what pollution and sources are causing the biggest burden? Who is being impacted? Are Clean Wisconsin's efforts missing anything? And then for future efforts, where should allocation of resources be going to try to address these environmental determinants of health? And to our knowledge, this hasn't necessarily been done in a formal, systematic way, but we know that this is needed to essentially, try to address these environmental determinants that are causing these health disparities. And, there is a lot of relevant, great information out there, but we're trying to pull it together and basically communicate it efficiently. And this is what this initiative is trying to do.
So for FreshAir Collective, environmental determinants of health, so obviously we're looking at air quality, right? I think to then dig a little deeper, we started deploying these air sensors across the city in the hopes originally to just be able to better inform the community about the air quality when this all started. Over time, we started to look at what areas of the community were experiencing worse air quality than others. Are we seeing certain patterns? And this was even before we had data experts that we were working with, and epidemiologists and other. I mean, sometimes it's just very visual. You can just see what the heck is going on over here versus over there. And why are we consistently seeing poor air quality in this community versus that community? You can just visually see it on a map, right? And for those of you who work in the data and look at some of the health outcomes data, when I was working at Children's Wisconsin, when I started this work, I had access to a significant amount of data, and often you would see, if you saw a map of Milwaukee, you see Fond du Lac Avenue. These were where you would see a lot of the worst health outcomes, just following Fond du Lac, right? Whether it was respiratory illnesses, heart conditions, you name it, right? And we see the same thing with air quality related conditions. And so we start thinking, this is one of the most trafficked state highways in the city as well. We need air sensors around here to help us better understand, what we think it is. Our hypothesis is that, those vehicular emissions are causing these issues, right? We need the data to prove it so we can start advocating for policy change in these communities. So we are systematically placing these air sensors in these communities. Now, we rely on volunteers to host our air sensors, right? So we don't have the luxury of just put them up on a street light or something like that, and somewhere right on the corner of 76 and Capitol. I would love that, but it doesn't work that way. So in many cases, we're just a block off of the main street. But if you're within 6 blocks, the air quality is pretty much the same. And so that's been our goal, or one of our goals over the last few years is placing these air sensors, that we have a better understanding of what that air quality is like, so we can paint that picture, so we can advocate for policy change within those communities. And so we've been looking at policies in other states, in other countries, of what is best practice when you want to improve the air quality related to transportation, right? Because there's a lot within our control as it relates to air quality. Politicians like to point to Canada and blame it on the wildfires. Oh, that's out of our control. There's not much we can do, right? That's the easy way to blow you off. But there's a lot that we can do, right? In California, they just made legislation that will cut off the selling of gas guzzlers, I think in 2030. I don't think that's going to be realistic in Wisconsin anytime soon, but what if we can say in 2040? What if we can say in 2050? Like those type of goals is what we're talking about, right? And what we're looking at. Ultimately, when we look at our policies, it still comes back to, is this going to improve the health outcomes of our original community that we were taught when we started this organization, right? That are disproportionately burdened by poor health, by poor air quality, right? And have worse outcomes because of it. And if not, then that's not what we're doing. Right? So that's got to be at the core of what we're doing. So that's kind of how we look at it.
You mentioned that there's a lot of things that are, in our control, and one of them is how we communicate the story of environmental health. So it's important to show and not tell. We know that, but how are you guys showing the story of environmental health in your communities and to policymakers, to people that can help make a difference?
Yeah. So I can jump in on that one. So I really leveraged the wildfires of last year to get media attention. I got really good at writing press releases. I've never been shy in front of a camera or on the radio, so I already had that, going for me. And my twin brother works for TMJ4, so he was able to coach me up on hey, you gotta do this. Don't say this, but be ready for this, right? And you challenge them even though they're not in the room, right? If you can call them out and say, well, we need politicians to stop sitting on their hands, right? What happens is they start getting phone calls from their constituents. When their constituents learn that, oh, they could have been acting, but they're not, right? Because you voiced that, they start getting those phone calls. They start getting those emails. They can dodge me. They can dodge my one email or phone call or whatever it might be, or when I see them in public, shake my hands and, oh, hey, Langston, yeah, we'll be on that right away. Yeah, no problem, right? But that puts that pressure on, right? What's even better is when you actually have policies to point to. And so we have some of those on our website. Frankly, we should probably update them. And, like most of our websites, especially if you're at a nonprofit, most of our websites need a little updating. But that just puts that pressure on them, right? And so the more pressure you can put on them, I think the better.
Yes, kind of to go off that, I think we have to recognize the value of localizing information and making the data real for the audience that we're presenting to. And this can be done by bringing that data to their level and really showing them how it's impacting their communities. For example, when I was wrapping up my public health degree, my practicum project, we used this term called Iowanizing, or making it Iowanized, because we were in Iowa. And basically, we created these policy briefs, and my role was to make sure to include Iowa-specific data and Iowa-specific public health issues in these policy briefs when we were presenting to the public and to decision makers. And I got to witness firsthand how that Iowa-specific data was much more compelling of a story to these policymakers than the generic data. They actually wanted to learn and wanted to listen and wanted to know what was going on with their constituents. And this is the theory of change that we're trying to bring to this environmental health initiative, is we want to Wisconsinize the environmental health data and environmental health determinants and disparities data when we're presenting it to the public and to policymakers. And our goal is to present concrete, evidence-based, localized data, and hopefully at the neighborhood level. And we really hope that this theory of change will help community members and decision makers become more motivated. Another example is our science program director, Paul. He looked at a research study done out of the University of Illinois a few years ago, where they were looking at particulate matter exposure. And he Wisconsinized the data, and he pulled out the state-specific data, and he found that Wisconsin experiences the third largest racial ethnic disparity for particulate matter exposure, right behind Pennsylvania and New York. So I think this is just a great example of, when you can show the magnitude of the state, how much more compelling of a story it is, rather than just relying on national level data. And that's essentially what we're trying to do with this new initiative in telling the story of the environmental determinants of health in the state.
I'll kind of echo that. The local data is very important, whether it's just communicating the evaluation results of our programming to our grantors, or sharing our program activities at a conference. I think showing the local data is extremely important because of how small of an organization we are, maybe compared to others here. And so one of the data maps that we used at a recent conference that my colleague actually presented was the urban canopy cover, as kind of a justification, or to give context to why we are localizing our work around the South Side, or around, I didn't say this before, but a lot of our work is localized around the Kinnickinnick River watershed, or Pulaski Park in the Kinnickinnick River. And it shows a lack of urban canopy cover, especially across the city, but in the South Side as well. So the localized data is very important. I'll speak a little bit to evaluation data. When we report to our grantors, our funders, we always emphasize, rather than the numbers, we always emphasize our testimonials, community feedback. And I believe almost all evaluations that we do, we always include community feedback, and that's what funders want to hear. They want to hear how it's impacting. It really breathes life into the numbers, because you can be reporting the numbers, but people won't really know what that means, or how participants felt, how community members felt when they received the program, and how they felt after it, and if they're telling their family and community members about it. And so from that perspective, it's always wanting to hear directly the words of the community members. I don't think I was at 16th Street for this project. There's another way that 16th Street has communicated stories, and that was through a storytelling project. They chose community members, I believe patients, and program participants to tell their story and their experience with 16th Street and the work that they do. And those were shared across the clinic, so that it's that bridging of environmental health and health, where internally a lot of our organization is really not aware of the work that my department does, and the impacts and connections between health and the environment. And so even within an organization that has done such historical work that many are aware of, members of the organization don't know about it. And so it's always uplifting, and I like what you said, Langston, telling or saying it even when they're not there, like always being persistent about sharing the story and saying it wherever you can.
I will echo that comment. Policy change takes a lot of time. So having the energy that Langston described to be able to come every day in with that same message is really important in building coalitions, so everyone is sharing that same message to the same policymakers. That's where you really can make a difference. I wanted to share just another example or two about the knowing your audience theme that we mentioned here. I think that's been really important for me, especially transitioning to this role at a new institution in a new state for me. I get lots of different questions about why I'm here and what I'm doing, and some of it is talking from the sustainability perspective and saying, did you know that US hospitals generate 8 to 10% of greenhouse gas emissions for the entire country? That's not improving the health of our community. How are we going to address that? Or when asked questions about new curriculum for medical students focused on climate change impacts on health, why are we teaching this? Well, we have more hot days, we have more flooding here in southeast Wisconsin, we have more tick populations increasing, more mosquito-borne disease here in Wisconsin. So we're going to see patients who are impacted by some of these changes in our environment. How are we going to ensure that our medical students, residents, fellows, doctors know how to address those changes in how the environment is impacting their health? So yeah, I think there's always a way to get into the conversations with, you know, the same end goal. You just have to take different paths depending on who are you talking to, why are they in the room with you, what is their motivation to be there, and there's always a way to negotiate and find a path for it. It'll just be a different conversation based on who you're trying to engage.
And I just want to give one other thing too. I think within this space, especially when you're working with policymakers, legislators, your quantitative data is so critical. I think we in this room likely, you know, we like the qualitative data, we like the surveys, and we want to be able to share the voice of our residents, of our community. You've got to have the cold hard facts of the percent improvement, the numbers, because that is what the policymakers are going to ask for. Like it or not, that's what they're going to ask for when you have that meeting. And the other thing that I would add is where I have seen success, not in this role, but in other roles that I've had, is you've got to be doubly prepared when you have a 30-minute meeting with that supervisor, that alderperson, that mayor. Count on it being a 8-minute meeting, and be damn ready with everything you got for a solid 8-minute pitch of why they need to make that decision, because that's likely what you're going to get. They're going to show up late and they're going to need to leave early. And so you've got a solid 8, maybe 10 minutes. And so you got to be ready with that hard facts about why this is the most important thing to them. And that's how it gets done. I've seen it time and time again, where I've come into those spaces and some of my colleagues were not ready to pivot, and we were totally lost. And so, when you think about making sure that they're ready to make a decision that you want them to make, you got to be ready to pivot as well.
Thank you. We know that, and you've all talked about this a lot already, but that in Wisconsin, disadvantaged communities are disproportionately affected by environmental issues. How is your work driven by that, and how do you go about looking to achieve environmental justice in your work?
I can go.
You can choose who starts.
I may have touched on this a little bit, as Mark said, but basically I think by using an evidence-based platform, our initiative, we have 3 main goals, and that's to tell the story of the environmental determinants of health to the public and to decision makers, to identify priority policies that are aimed at addressing those determinants, and to direct resources towards communities that are experiencing those greater disparities, and then lastly to identify and fill gaps in knowledge in this space. And I think in order to do this, to accomplish this, we have to not only understand the disparities, but we have to understand the data behind the disparities and the drivers of the disparities. And I think once we can do that, we can then prioritize policy that's aimed at addressing not only the disparities, but the drivers behind it. And same with when we allocate resources to, the things that are driving the disparities specifically. So, but additionally, I think that our program is addressing, health equity more generally. Our core competencies include health equity and collaborative leadership. And I really just think it's important to remember that environmental justice is one component of health equity. And just as we've all talked about, that, health is so connected to the environment.
Well, I've talked quite a bit about the outdoor education that I work on, and I would say that's one of the main ways that the Department of Environmental Health, I always get tripped up on that. The Department of Environmental Health at 16th Street is really striving for environmental justice. I'll touch a little more on how we implement the Nature Explorers program, and it's through really robust collaborations and partnerships. I mentioned the field trips, and so we've partnered with Milwaukee River Keepers, Milwaukee Public Museum, I have a list, Milwaukee County Parks, Kinnickinnick River Neighbors, which is a neighborhood organization based at Pulaski Park. And that is really providing that experience for kiddos, but it doesn't stop at kids. We have family workshops that are also very highly experiential. So people can be doing a fishing 101 or a harbor boat tour or a bicycle tour, and also learning about the importance of clean rivers in our city. I'm gonna go down a list. We had a forest bathing session where people were practicing mindfulness in one of our I think it was Ware State Park, I'm not sure. And they learned about the importance of protecting green spaces and accessing them. What else? We have our neighborhood revitalization coordinator or project manager now, Yessie, maybe some of you know her, coordinates an internship program, which is a little bit similar to our Nature Explorers at a high school level. It's a paid internship as well. So they are exploring environment and food systems. So it's kind of more of an environmental justice focus, but it's also a very big opportunity for those high schoolers to explore careers in environmental health and sustainability. And then that contributes to who is represented in environmental work and careers. We have the community advocacy team or coordinator who has healthy food access tours, which teaches mostly Spanish-speaking community members how to navigate the public bus system while they're on the bus on that tour. They learn about the benefits of using public transportation and its effect on air quality when there are more people on buses and less on cars. They take the bus to local grocery stores, and then they take the bus to the local farmers market and then learn about how to navigate the farmers market and the benefits of buying local food. Part of that person's role is also a community advocacy leadership program. There's a lot. Community members enroll in this leadership training program where they learn about different aspects of health, so mental health, nutrition, physical activity, and they have started to incorporate food systems and food justice into the nutrition portion. And then when they graduate that program, they can then lead programs, some of our programs in the community. They are kind of like community health workers, volunteer community health workers, which we appreciate and love. They are called Leaders for Health, or Líderes por la Salud, LPLS for short. And so they've led walking clubs, walking and biking clubs. They've led some of the healthy food access tours. And that's not only beneficial for their immediate health, but it really builds social cohesion and that's what they're actually asking for. They're not necessarily asking for programs to improve their health, but they know that being together in those spaces, they're doing two things at once. We also have two more. Our lead outreach team that does door-to-door service, lead testing at outreach events and in-home education if they are encountering children with high lead levels. And finally, our community schools coordinators who are working in 3 public schools in the south side of Milwaukee. Coordinating community engagement and developing action teams around ways to make their school more safe, more sustainable, a little greener for all the kids and the families, making it a community hub rather than just a school. And so all that is to say, that's the work that we do, and there are a lot of community partners involved in that. Langston informed me that there was an air quality monitor at one of our community schools, and we worked with so many different organizations across the city. So the education, the partnerships, those are all working towards advancing environmental justice and always making communities aware that they have a hand in it, but there could be things at play that they can influence so that things change, not on themselves, but community-wide politics, yeah.
I'll just share one brief partnership that I've been grateful to be a partner in here. One of the faculty members at MCW in the Institute for Health and Equity is a member of the Ojibwe tribe located in Lac du Flambeau, Wisconsin. So I was able to visit him for the first time just last week. And he's been working for several years on creating cohesion within his tribal community through a project called Family Circles, so healing intergenerational trauma, engaging families together. And through that program, we're trying to speak with elders about their historic treaty rights to preserve land, air, and water quality for hunting, fishing, gathering, their traditional ways of feeding themselves, fueling their communities, and maintaining a healthy life. And the elders are going to be interviewed and will share those stories, another traditional mechanism of storytelling, with younger members of the tribal communities to build that bridge between generations, but also to remind younger generations of those historic treaty rights that they have to hunt, fish, gather on their own reservation, and the importance of fighting for healthy, clean land, air, and water to preserve the health of their ecosystem and their own health as a result. So it's a really beautiful project, thinking about community and reconnecting elders with younger people in the community who are struggling with a lot of other issues, but at the same time talking about environmental health literacy and reminding the youth about their rights too.
Yeah, so I think to touch on, trying to weave in things that I haven't said already. So where we're kind of pivoting the work is trying to minimize the burden that we're putting on the community. I think historically we would say to community members, download this app, come to our training. We need you to essentially do something. And again, we want you just to be able to go outside and breathe the air, right? So you shouldn't have to do anything. And what we've also noticed, like when we do these trainings, like we have to do a lot of hand-holding and help to get people to like install the app. And, so as I'm helping folks install the app, I'm like, oh, you've got 82 unread notifications. So even if I do install this, you're probably not going to see the notifications when the air quality score anyway. So we have to think differently about our approach. And so we've been coming up with new kind of thinking around how we want to interact with the community. I'll give you one of those examples of what we're working on right now. And so we recently received some funding to develop a mural. We're working on a mural project with a local organization called True School. So this mural is unique in the fact that it absorbs particle pollution. The paint that we're using absorbs particle pollution. And so the mural itself is going to be placed in I think it's called I'm going to say it wrong, the Capitol. It's in the Clean Wisconsin neighborhood. Capitol, what is it called? Century City. Thank you. Sorry. Why was I thinking? Because it's near Capitol is what I'm thinking. Century City neighborhood. So we're working with a community association over there to essentially have True School develop this mural, have their neighborhood association select, from a few different designs, and then we'll have True School paint the mural and make it kind of a community-wide event. We'll place an air sensor on the mural itself. So in a sense, the mural will be doing the work so that they don't have to. right? So the mural will be absorbance of pollution, a minimal amount, right? It's not gonna change the air quality, right? It's kind of a catchy thing more than anything else. But we'll get some media attention, which is what we're trying to draw in to the poor air quality in the area. We will, have a QR code there, invite folks to install the app if they want to, don't have to. But the cool thing we're also doing is setting it up so that the mural will automatically send tweets and or emails to local legislature when the air quality is poor, right? So the mural is now working on their behalf so that they don't have to do those things, right? So when the air quality gets above 100 AQI, it's sending those notifications to Mayor Johnson, to Tammy Baldwin, to whoever else to say, like, the air quality on 27th in Capitol, on 35th in Capitol is horrendous. What are you going to do about it? Here's 5 policies you can start working on right now to help make this better for this community, right? Or did you know X number of people lost their lives early last year because of poor air quality? Start fighting for your community, right? And so we're taking different approaches so that the community doesn't have to lift a finger, right? And when they do, they'll show up, they'll have some fun, they'll come to the party that we're gonna do to launch the event. They'll get some free food, they'll see a beautiful mural in their community, and that's kind of all they have to do if they want to, right? So it's kind of how we're thinking about it a little differently.
That's great.
And if you want to donate to the mural, you just go to our website. You need a little more money for it. So.
Well, that mural story is a really interesting one, and kind of leads into my next question, which is really what's something that makes you really optimistic that you're actually going to be able to achieve some change, that you're going to be able to address these disparities that we've been talking about tonight. So what's something positive or optimistic that you can point to in your jobs?
I guess I can start since everyone else has started. There are a few small things around the clinic. So once providers and our clinic side became more aware of our programming, our referral lists got really long, a little bit unmanageable, but really nice to see that doctors are really seeing the connection and wanting to refer a lot of the patients to the programs that we offer. And they're, like I said, they're very robust. And because of all of that interest, we're seeing our summer camp only is able to have 10 kiddos over the summer, but our waiting list was 20 kiddos this year. So that was really, it's the small things that are really making me optimistic. And then people just coming away from the programs with expressed knowledge and care and wanting to learn more and wanting to do something about it, or wanting to talk to the right people who are going to do something about it. And then just the maintained relationships. Like I said, we had a kid who was with us from 6 to 12, and her family is really involved in a lot of the programs and community building that we provide. And so seeing returned interest, seeing new interest is making me feel very optimistic for what we can maintain and grow our programs to be, to impact and improve environmental health and people's knowledge about how they're connected to it.
Yeah, I would echo a lot of that too. I think what brings me hope is seeing a panel like this with people coming from different organizations and perspectives with the same goal in mind. And I feel that every day coming to work, I meet somebody new who I didn't know existed yet on this campus who's enthusiastic about the work. And part of the reason that the center was established was because medical students were asking the dean for climate change in their curriculum. It's something they advocated for. They put a letter together. So change can happen. I think the younger generations are really engaged in this space. So I have hope. It can be very daunting to think about all the things in front of us, but just making small changes every day, it makes me feel good and feel like, okay, we've done something today and we're gonna do something new tomorrow, and just keep chipping away at this and building our collaborations, our coalitions, and we'll make a change.
Yeah, sort of to go off that, I think we're really excited about this initiative shining a brighter light on the environmental determinants of health, especially when sometimes the social determinants of health tend to get, or other social determinants of health tend to get a lot of focus. You know, sometimes the environmental determinants of health have been historically overlooked or sometimes not even talked about in the same space as the social determinants of health. So again, like Christa said, I think it's very exciting that we have people working in this space and advocating in this space. And again, the fact that we're sitting here having this conversation is a great step in the right direction. And I think the more attention that we can bring to it, the more we can, you know, truly understand it, and the more we can effectively intervene.
Yeah, I know you're not asking my opinion, but I actually totally agree with the things that you said, and I feel optimistic because we're talking about this, and because you all are here doing this, and some really great work is coming out, and I think the partnerships for me really feel really exciting. New partnerships that, you know, when we leverage off of each other's really strength, you know, good things that you're doing, and the strengths that we all have, I think, and focus in on this work, we're going to make a big difference. So I'm excited about that. So maybe each of you can end with like just telling us something that we all can do. Something, you guys are doing great work, but what are some things that people who are listening or in the room can do to make a difference?
So I'll jump in. I did want to highlight my one thing I'm excited about though.
Oh, good. Sorry.
So, and only because I got a new partner in the room. So Danica Hill Paulus is my new, our new co-executive director. And the reason I'm excited is for like 4 years I was doing this on my own, and like it's a lot of work. And so to have a partner is like, we've already been just rocking it out together as colleagues, because we worked at the health department together for a while. So like having our own team, got a lot of indoor air quality expertise. We're learning a ton from each other. So I wanted to highlight that. So make sure you highlight, chat with Danica if you have a moment.
And we were supposed to get to the mural too, right?
Yes, and get to the mural. MKEFreshAir.com. So I think the thing that you all can do, there's a lot of folks, maybe not in this room, but that are trying to take DEI out of the room and out of the conversation. And I think no matter, you know, how that goes, I think it's important for us to make sure that stays in the room. You can't have environmental justice if you don't have a conversation about systemic racism, right? Like you can't ignore that. You can't ignore that history. And so, you know, maybe that conversation isn't happening at this organization right now. It will eventually. Maybe it's not happening at Clean Wisconsin right now. Maybe the funders that's starting to have those conversations there, or the funders of the funders. Like those things trickle down over time, right? And so we've got to be the ones to push back when those conversations start to come to our desks. And so that's where I really urge everyone in this room is to be those advocates and to be those co-conspirators to continue to contribute to that change, right? Because I get super pumped up because like the young generation, like they're fighters, right? But they need us to continue to fight for them, and not like make it harder for them. And that's one of those areas where I think we have to be their champions. So I'll stop there, but make sure we keep pushing. When our funders, when our bosses, when our executives say, oh, well, why are we talking about that still? Isn't equity just enough? Let's just that. We don't have to talk about race anymore. Like, we got to push back, all right?
Yeah. In general, I think positive change can, you know, it begins at being better informed about what's going on around you and what's going on in your communities, and especially, being able to identify opportunities on where your voice can be heard and where your voice can be heard through policy. And, especially with it being this year and just remembering, when voting, understanding where candidates stand in relation to policies that may improve public health or help clean up our environment. And I think that's something that we can all do, and it's a place that our voice can be heard. And, I also think that meaningful civic engagement can truly try to mitigate some of these disparities. And I think civic engagement can also empower historically marginalized communities. And, lastly, I really think we should keep encouraging cross-sector collaboration between, non-governmental, governmental, the healthcare sector, and community-based organizations, because, we're not going to solve this individually. We're going to have to work together to truly try to accomplish this change. And, with that, then being able to, give resources to those communities through cross-sector collaboration. So.
I think they both gave really great examples of different avenues for change. So I'll just add that it will be important to keep an eye on the work that all of our organizations are doing, or even look at how your own organizations are trying to be sustainable or contributing to our work or the field, the space of our work. And I'll also echo what Kayla said about thinking of the ways that environmental health is being impacted and addressed, not only in your workspace, but in your own life, in your own community. What is being done in my community? What isn't being done? How is this different from others around me, other communities around me?
Yeah, these are awesome ideas. I think I would just, the cherry on top, I'd say, is just do something. What did you hear tonight that made you think, I want to go work on this thing? Find your people, find your coalition. They're out there doing the hard work and willing to be by your side. So I think we just have to keep this conversation going and keep providing energy to each other. Sometimes in the planetary health space, I've heard folks talk about a relay race. Maybe you can't run the marathon today. It's just, you need a minute. So who you can hand that baton to keep this conversation going, and then you can come back around when you are recharged. But I think also a great comment, keep up with us too. If there's something that anybody on this panel said that piqued your interest. Shamelessly, I brought some QR codes here with our website and our listserv for our monthly newsletter. So if you're interested in MCW's work, I have that too. But we're glad that you're here, and thanks.
Well, thank you all for taking your time out of your evening night to tell us your stories. We're all inspired by the organizations that you're part of, that you started, and the work that you're doing within them. Thank you so much, and thank you for from Cleveland, Wisconsin, and talking about environmental lecture series. Thank you.